The topic of discussion today is on CT equipment selection. This is a common question a physicist gets asked in any setting about which scanner he or she would choose. And it's not a very straightforward answer one can provide. It's very difficult, and also one has to be cautious of lining up with one manufacturers or the other, thereby that person can appear as a bias to a particular selection. So the topic of discussion today is to see what the process is involved in a proper selection of an equipment. So the topic I'm going to talk about is to identify the clinical needs, followed by the writing specification, invite the manufacturers to meet the specifications, review of proposal by manufacturers, select the vendor that match the user's need. That follows by the construction and installation of the CT scanner. The final piece of this whole process is the commissioning, or also called as acceptance testing, and setting up a routine quality assurance program before the scanner is started to be used on the patient. This is the idealistic process, which is what one needs to follow. So, the first common question is, which CT scanner should I pick? It's not simple and straightforward, because the phases in equipment selection process involves the following. First of all, one needs to assess the need and the specification phase. They need to review and also compare the manufacturer's data for a few different manufacturers' data, which is usually followed by the vendor selection phases. This also includes site visit, talking to the other sites where they have a particular equipment, etc., followed by a construction and installation phase, and acceptance and commissioning phase. Then starts the clinical application phase. So the selection process greatly benefits from discussions among radiologists, physicians, technologists, and medical physicists. I consider this as a teamwork. Thereby a clinic can have a proper process in selecting the right equipment for their particular need. First among these lists is the identifying the goals and needs is very key, because in selection process one can group a general purpose CT scanners or a special purpose CT scanners. So if you identify the needs and goals in the beginning, it's easier to go through the different available scanners to pick the right one. So what is a general purpose CT scanner different from special purpose CT scanner? So a general purpose CT scanner can be thought of as follows. It can be thought as used routinely for imaging all anatomic region. So this should become like a bread and butter of that particular department in terms of the CT scanner. So any particular imaging, any type of imaging can be done on this particular CT scanner. Second and foremost, the other requirement for a general purpose CT scanner is the scanner should accommodate all type of patients, whether a pediatric patient or an elderly patient or very extremely obese patient and so forth. It should be able to accommodate all type of patient, because that the purpose of the general purpose CT scanner is that it will be the go-to scanner in the hospital or a clinic. Should require minimal downtime. This is very important for a remote clinics or a clinic which have very few number of CT scanners, or clinics located in a very remote area. The demand for minimal downtime is a very key in selection process. For a general purpose CT scanner, doesn't necessarily have to be the latest scanner, but it has to be a stable scanner. Therefore, it works routinely correctly. It's also important to remember that these scanners deliver the optimal images at optimal dose. What about the special cell application CT scanner? This usually clinics which are doing high-end research or want to establish at the edge of the CT scanning field want to acquire a special application CT scanner. For example, a special application CT scanners can be pediatric CT or a neuroradiology CT, or purely cardiac CT. First and foremost, the special application CT scanner should meet all the requirements required for a general purpose CT scanner. In addition, it is also important to identify the type of resources our manufacturers can provide for a specific application. It is also important to understand that these special application CT scanners should also have a minimal downtime. What are the challenges in selecting CT scanners? If you look at the the type of CT scanners available these days, it's very difficult to differentiate the good ones from the bad ones. They all look good on the paper. So the most key features are similar among various CT manufacturers. As of now, most 16 or 64 slide CT scanners are best suited for general purpose use. A 16 slide scanner or a 64 slide CT scanner can do pretty much every CT protocol, all the way from routine CT imaging to hybrid imaging or cardiac CT or CT perfusion and so forth. So therefore, these scanners can accommodate pretty much all the current applications which we do in clinic. However, the non-technical issues become very critical in selecting the CT scanner. First and foremost, to minimize downtime, it is important to assure that the availability of service is key. I have seen in situations where a remotely located clinic will acquire an exotic new CT scanner. However, the availability of service reaching to that particular remote clinic is so long, thereby the CT scanner sit idle for a long time. And especially this is true when in a developing countries or underdeveloped country that they acquire a CT scanner probably because of some donation from an endowment, and they install a very latest and greatest CT scanner, but forgot to look into this aspect of what the availability of the service from that particular manufacturer. In such cases, the CT scanners almost become less useful, and it will have a lot more time sitting idly because of the lack of service. The second non-technical issues become very critical is the tangible issues. Tangible issues such as clinical training, support for research projects, especially in the special application scanners, becomes very important in selecting the CT scanners. Here are example of vendor responses. What I'm trying to show in next few slides is clinic, when they are acquiring a new CT scanner, write a specification. Specification involves what we need from a scanner and what is the scanner going to be used for and what is the minimal requirement the scanner requires. The specifications are written in such a way it's not designed to meet only one particular manufacturer selection. It should be quite generic that all the manufacturers available should meet, can at least come to this meeting point. So for example, here is a request in the specification asking, equipment is heavily used during downtime. It will be necessary to relocate a significant number of patients to a different hospital. So one of the requirement in the specification they're asking is how fast the scanner can be installed and get running. Bottom shows the response from a particular manufacturers, basically telling it estimates that it will take approximately 6 to 7 working days to deinstall the current 16 slice CT scanner and reinstall the 64 slice CT scanner during normal working hours. So when we are comparing different specification coming back from the various manufacturer, this can be one of the things can be compared apple to apple across the manufacturer to see which can do a very fast installation, and therefore you have a minimal disturbance in the workflow of a clinic. That's one request. Here is a second response. The request from the clinic in the specification was they wanted a CT scanner which has a gantry size to be 70 cm in diameter or greater to permit scanning of large patient without claustrophobia. 70 cm is kind of the most common size of the CT gantry which all the manufacturers produce. They also mention here or greater, in the sense it can be greater, but it's not a determining factor in the selection. So one of the manufacturers comes back with a response to the specification telling They do have 70 centimeter diameter gantry size, which meets the specification. But they are also available 78 centimeter diameter to accommodate large patient. Here is another example. The request is describe the localization feature of gantry. The response comes out and tells all these other features such as what is the rotation time, the gantry tilt, scan field size, gantry width, and so forth. This response for a particular request allows for the team in the clinic to compare from different manufacturers and help in the process of picking the right scanner. Here is another request regarding the gantry X-ray tube. The requesting is to describe the size, weight, and cooling characteristic of the gantry. Again, here the gantry is 4,400 pounds weight. That can be a determining factor how you design of moving the movers to bring the gantry into the clinic, at what location. This will also determine the weight of the gantry, will determine where the CT scanner is located, and if wherever it is located, does the floor needs to be reinforced, etc. Again, this is another factor. This is one common request most all the clinic will request now. Does the CT scanner table supports patient weights of at least 500 pounds? Unfortunately, these days we see patients of extremely obese patients. Therefore, the clinics now are looking for scanner which can accommodate extremely obese patient. So the response here from this particular manufacturer is the maximum table load they can accommodate is up to 615 pounds. They also have an optional one at a higher cost at 660 pounds. The second request is the high voltage range. This determines the clinic is wanting to look whether the CT's operates are calibrated at 80, 100, 120 and 140 kV, and the response comes, it's available for all the kV requested. This is another request asking about this, the gantry rotation time, which determines the temporal resolution and so forth. They're asking a short scan time, 0.33 seconds or less, to facilitate vascular reconstruction. Shortest scan time for this particular request response is it is less than 0.03, so it meets the request and so forth. Sometime often the clinic can become very picky on a particular manufacturer and make the specification too tight that only one manufacturer is made, and that's usually not a favorable way of doing a CT selection, and sometimes it can also be misleading. Here is a response asking what is the dose parameter for a 20 centimeter phantom at various tube voltage and kV. It's basically telling is what is the radiation dose for a particular specification, and here's the response. And here's an response from a particular manufacturer indicating the dose saving features. This is another request for a high-end scanner asking for completing CT angiography package. What are the availability in the scanner? And the response from one particular manufacturer provides all the details, such as what the packets they have. So in conclusion, the process is a lengthy process, but when done in a team environment, one can have a choice of picking the best scanner that fits the requirement. So the medical physicist can play a valuable role in CT scanner selection as part of the team that also includes the radiologists, technologists, administrators. As most advanced CT scanners have similar features, the non-technical issues become equally important, such as the minimal downtime and such as the tangible benefit a particular manufacturers provide can weigh heavily on the selection. At the end of the day, it's important to minimize the downtime. Issues such as availability of the service in the local area becomes very critical, and availability of the parts, optimal service contracts, and good working relationship with vendors trounces even the type of scanner, because this becomes an important process in the workflow of the whole scanner selection. I want to end this podcast also showing some valuable resources available for a clinic if they are buying a new scanner and they want to put some generic CT protocol. One good resource right now is the American Association of Physicists in Medicine. They have generated a series of generic CT protocol for all the manufacturers. It's freely downloadable, this protocol. Basically, this was developed based on a committee work that involves representation from each manufacturer for this standard protocol. Shown here are the protocol for lung cancer screening from all the manufacturers for all their models 16 and above slice CT scanner. So in conclusion, it is important that we have the scanner picked which has a minimal downtime and it meets the needs. Therefore, identifying the needs of a particular scanner becomes very important.